who have not seen Michael Moore's movie Sicko, you get to see Donna and her story and the story of many others. I would like to now introduce our next guest, who as a healthcare provider reminds us that what our system is about is medical care and providing.
I was one of those millions of Americans who always carried health insurance, and I was unfortunate enough to get cancer, and my husband has some chronic illness issues, and even though we always had insurance, in fact we also had disability insurance and a healthcare savings account at the same time, when I got sick we found out what it didn't cover and what we couldn't get taken care of, and we ended up losing our home first, and then eventually we still couldn't pay all the bills, and we ended up going bankrupt and moving in with our daughter, and it was a really rough slide after working a whole lifetime for everything we had tried to achieve, and then losing it all in a matter of months. You go to a hospital here, and you may go to a hospital that's part of your insurance plan's coverage, and yet you find there are people actually inside that hospital who don't take your insurance. So while you get a bill from the hospital that may be covered 80%, for instance, you get home and you start getting bills from all sorts of other providers who touched your body somehow along the way that you didn't really know what their situation was, and you owe thousands to them as well that the insurance pays minimal amounts or nothing to.
I think our members generally favor a private healthcare marketplace. And secondly, we would have concerns whether you do in fact crowd out by government competition, you crowd out the private sector. So
I'm not sure that either the government or the private sector really has a good handle on running things. I think that Oregon has done a very fine job of designing a system that works and has kept costs going up more slowly in a lot of cases than in other, certainly than commercial costs in the state.
I don't know that Obama has a plan per se for healthcare reform. He has a lot of ideas that he would like to incorporate into healthcare reform. The plan has elements that if they were actuated would be useful, okay, but there are also elements that are very contentious and probably would not lead to meaningful reform if they get the hackles up of all the interested parties, let's put it that way.
Is really controlled by pretty much monopolistic sectors in terms of the pharmaceutical industry and the hospital industry. And until you address those costs in terms of the services they deliver, you're not going to have real health care reform that you can afford.
President Obama has signaled to the nation that he is serious about health care reform. We applaud the president for prioritizing this issue and for setting aside the resources that are needed to reform the health care system. We are very optimistic that we can achieve something in this country that we haven't been able to achieve for the past 100 years. America's Health Insurance Plans is a trade association that represents the health insurance industry. We have 1,300 member companies that provide coverage to more than 200 million Americans. We think Congress should set a national goal of reducing the future rate of growth of healthcare costs by 30%. Healthcare costs are rising 7% a year right now. If we could just bring that down 1.5–2%, we could save $1 trillion over the next 10 years.
I think that the government entities need to stop responding to the pressures from the highly financed lobbyists in the hospital industry, the DME industry, and the pharmaceutical industry that keep driving up those costs with really no apparent value to the healthcare system.
Being in Michael Moore's movie it's not something you ever really aspire to do, I don't think. First of all, to be in a documentary like that means some pretty terrible stuff happened to you to make you the right candidate for the movie. The other thing I was always so acutely aware of, and still am, it's part of the reason I still fight for health care, is that we were not in the film because we were unique. We were chosen to be in the film because we were not unique.
We need to invest in health information technology that can improve efficiency, that can reduce medical errors, and ultimately lower healthcare costs. When we traveled the country last summer for our nationwide listening tour, we heard from the American people their priorities for healthcare reform, and what we heard is that people want a uniquely American solution to healthcare reform that builds on what's working in the current healthcare system. Our policy that we outline, we believe is workable, we believe it can pass, and we believe it will address all of the challenges that are facing the nation.
Recovering from the bankruptcy, as you might imagine, is horrible. We label people who go bankrupt in this country worse than we label some criminals in the country. We label credit reports for years, really, literally years. It's hard for me to rent housing even now because they look and then, oh, you went bankrupt. They don't really care why you went bankrupt. I may never again be able to own a home because people will look and say this was a bankrupt. They don't care why. So it's very hurtful. My husband is 64 years old, worked all his life. Very difficult to think about him. Very difficult.
First off, the American people don't want it. We have done surveys and have seen multiple surveys showing that the American people want an approach that builds on what's working. And really the other part of this that needs to be looked at is the sustainability of the public programs that we have.
My personal preference and what millions of Americans have said they want is to go to a single-payer system. I think a single-payer system mixes the best of what the left side of this argument, which would be public financing, with the right side of this argument, which was private delivery of care.
Donate today and receive a new documentary film available to members of the Real News Network. The History of the National Security State with legendary author Gore Vidal. Bonus features of the DVD include an in-depth response to Vidal from ex-CIA analyst Ray McGovern, who served under 7 U.S. presidents, an exclusive interview with Colin Powell's former Chief of Staff Larry Wilkerson, and an insightful interview with oil policy analyst Antonia Juhas.
The news magazine of the screen. Living glimpses of history in the making.
Hollywood and Washington is a symbiotic relationship. They both deal with illusions. Reality doesn't often play much of a part. I think I saw through the myth of the Cold War almost from the beginning. I was a Washington political kid from a political family. Roosevelt first had radio because he had this great speaking voice and everyone liked to hear. Truman proceeded to break every arrangement that Roosevelt had set up for a peaceful coexistence. And Truman thought that it would be a good idea. Why not just stay armed all the time? And then he devised the national security state. You've got to go up and swear allegiance to the United States or else you're a commie. I mean, we had imported fascism. We get Dwight Eisenhower, who said that we have this great military industrial complex. It is a dangerous thing. And he said this is going to change everything. And the way our country is governed is going to change us politically. Along comes Jack Kennedy, who wanted to make his mark, believed in the Cold War. But he said in this kind of politics, it is the appearance of things that matters. I think everybody should take a sober look at the world about us. The national security state still exists, only it isn't communism anymore, it's terrorism. This is the most serious thing that has happened in the history of the United States. Knowledge is power. We need an honest news system.
We need the real news.
This is the sort of thing we can build right now without anyone else's permission from the government or from the business community. It's the power's in our hands.
If we're not going to sleepwalk into more wars, we think we need to start with a television news network that won't bow to pressure and has the courage to seek facts. And that means independent economics. And that's why we need you.
Make a tax-deductible donation now of at least $10 a month or a one-time give of at least $75. As a thank you for your support, we will send you the new documentary film, The History of the National Security State.